Hello. On behalf of the Froedtert and the Medical College of Wisconsin's Kidney and Pancreas Transplant Program, I would like to welcome you to our video education series on transplant. During this video, we will cover the role of the Transplant Financial Liaison. A Transplant Financial Liaison is a professional who helps with financial matters and hospital billing related to a transplant. They will work with other members of the transplant team, insurance companies, and administrative personnel to coordinate the financial aspects of all care related to transplant. They will help determine how patients can best pay for their transplant. It is important for patients to have sufficient insurance benefits to be eligible for transplant. It is our job to make sure that patients have proper coverage and they understand what is required of them before and after receiving a transplant. A transplant financial liaison will meet with patients in the transplant clinic during the transplant evaluation. There are a few things patients should be ready to discuss. First, the liaison will review current and past employment, as well as current income. This will let us know if there are any short or long-term disability benefits available through the employer. We also need to know if patients are receiving Social Security benefits or a pension. This will help the transplant team understand if there are additional coverage options available. Next, the liaison will review the current insurance plan or plans a patient has. There will be a discussion around what benefits are offered and how much a patient may be expected to pay, as well as if there are any limitations on where services can be provided. The liaison will then talk about the 3 parts of Medicare, as well as the different ways patients can become eligible for Medicare. The liaison will determine at the clinic visit if a patient is eligible for Medicare or when they may become eligible in the future. Another topic that will be covered briefly is living donation and how those services are covered. Patients will receive a list of the medications commonly taken after transplant. The list will include how these medications are billed, including what the patient out-of-pocket costs will be for each one. Additionally, options will be shared to help lower out-of-pocket costs. Finally, the liaison will determine if a patient needs any additional help, including fundraising options that are available to transplant patients. As a member of the transplant multidisciplinary team, the financial liaison is there before and after transplant to help patients navigate the costs associated with their transplant. You have reached the end of this video. We encourage you to continue watching the videos in this series on kidney transplant. Thank you for choosing Froedtert and the Medical College of Wisconsin.